Today we have 3 cases of resuscitation from historical medical textbooks from the 17 and 1800s. References are in the notes if you want them. Case 1. Drowning resuscitation from 1774. Amsterdam, 4:30, Hendrik Wignum falls in the canal. And yes, he was drunk. In fact, with the benefit of hindsight, that's all that was wrong with him. So bear that in mind when you hear about the so-called treatments he was given. In the water for a long time, fished out. When the apothecary, which is a pharmacist, Mr. Oosterlin came, he finds not the least symptom of life, body stiffened, etc. Mr. Oosterlin applies the tobacco blister, which is a tobacco smoke enema, but found no constriction in the sphincter muscle, so one assistant was forced to hold the pipe, and the other to close the fundament. Can imagine how that went down. I'll hold the pipe, you close the fundament. Nah, I did the fundament last time, you do it. Anyhow, time goes on, they apply a second tobacco smoke enema, and they think maybe he's improving a little. Now they've been doing this for 2 hours, so they do a third tobacco smoke enema, but the wooden tube breaks. Oh no! 2 brothers of the patient turn up, and one does mouth to mouth. Good old Mr. Oosterlin keeps tickling the nostrils with ammonia, which at last has some effect. Yep, it was the ammonia. 9:30, Mr. Oosterlin leaves. Comes back at 11 and Hendrik's putting on his stockings and soon walking home with his brothers. Case 2. Opium toxicity from 1866. A woman was admitted in the summer of 1866 to Bellevue Hospital suffering from a bad attack of Asiatic cholera. She stated the attack came on 4 hours previous, and while at the station house, a police officer had given her a tablespoonful of pure laudanum. What is laudanum? Opium. Police don't seem to give away as much opium these days. Anyhow, the doctor wanders off, and the nurse calls him later saying the patient is insensible. So injections of brandy, ammonia, and strong coffee are ordered. In this case, injections means giving it rectally, so rectal brandy, ammonia, and coffee. Flagellation applied with twisted towels for 2 hours, by which time signs of consciousness appeared. The patient was then marched rapidly up and down the ward, supported by her nurses until fully restored. 5 hours were spent in bringing this woman to a state of consciousness. Case 3, and this is translated from French. The title of this is The Physiological Treatment of Death. Such a good title. Rhythmic tractions of the tongue, a rational and powerful means of resurgenting respiratory function and life, by some guy called Laborde from 1894. 11 p.m, a 76-year-old sailor is drunk and falls in the harbour. Same as the first case, being drunk in retrospect is his only actual problem, which puts his supposed resuscitation into context. Anyway, by some luck, a guy throws a hook in the water, catches him and pulls him out. Doctor is called. As soon as he arrives, he jams the mouth open with the end of his walking stick, grabs the tongue with his forceps and pulls on the tongue at a rate of 18 to 20 times a minute. He continues this for 20 minutes, despite everyone saying that it was useless. But then he gets the great satisfaction of feeling small breathing movements coming from the diaphragm. After a time, the man's given hot drinks and taken home. At 4 a.m, the patient is seized by complete evacuation from above and below, and immediately all functions return to their normal state. 36 hours later, my good man resumed his duties as a boatman. So a happy ending. Okay, bye bye.